So as you have heard, and what I spent sort of the beginning of my career on, is this fact that people who are incarcerated are in poorer health than those who are not incarcerated. This is no surprise. People who are incarcerated have higher rates of everything: hypertension, heart-related problems, diabetes, stroke, really any chronic condition. But over the course of multiple prison visits and many years doing this work, I began to realize that mass incarceration also has an alarming negative impact on staff, who experience high rates of the very same chronic health conditions. Many report perceptions of a constant threat of violence. Withdrawal, isolation, and conflict at home are common. And they have elevated rates of severe depression, suicide, domestic violence, and substance use disorder. The average life expectancy of a U.S. correctional officer is a shocking 59 years. And when I really started to understand this, it occurred to me that this is a potential untapped opportunity, basically getting officers in prisons to demand that they have a new job because of the poor impact on their health. Because as you've heard a lot this morning or this afternoon, dehumanizing overcrowding is very common in the era of mass incarceration, and so is dehumanizing isolation. The Lyman report tells us that 45 to 48,000 Americans are in isolation at any one moment and any given day. Again, 23 hours a day, 7 days a week in a cell roughly the size of like an ADA bathroom or a parking spot. It is disproportionately experienced by people of racial or ethnic minority and those who identify as LGBTQ. And the science is clear. This causes profound harm to mental and physical health, everything from self-injury and suicide to post-release mortality. It is also clear that staff working in these units experience extremely high rates of stress, trauma, physical and moral injury, and burnout. There has been exceptional political activism on this issue, mostly really organized by and run by people who have experienced this type of confinement or who have family members who have experienced or are experiencing this type of confinement. But there has been surprisingly minimal response from the healthcare professions. And so I spent sort of the early part of my career in this area, conducting research on the harms of solitary confinement, serving as a medical expert, going into prisons, talking to people in litigation, working with judges and lawyers and advocates really around the public health and health consequences of this practice. And over time, I increasingly saw the limits of externally driven reform, at least from a healthcare perspective. And that's for a few reasons. First of all, knowledge and evidence about how harmful solitary confinement is not the problem. Like I said, it's pretty clear. Also, a one-size-fits-all approach to fixing the problem does not account for different complex needs of the different complex people who find themselves in these settings. So a high-functioning person with severe violent misconduct needs a different intervention than a person who self-isolates for decades because of a history of trauma and fear. And litigation and legislation, while extraordinarily important in this area, they don't do everything. They often fail to differentiate needs between those two kind of extreme types of people in isolation, and they often do not invest in solutions because people in prolonged solitary confinement need more support and resources. And those need to be clarified, and staff need enhanced training and new skills to deal with the medical conditions and the behavioral health conditions that exist in these units. I decided to stop studying the harmful effects of isolation and really turn my eyes towards focusing on identifying and investing in new kind of health-related solutions. And I found that surprisingly one potential model in Norway, where their correctional approach is rooted in public health and human rights. This is their very basic motto, which is profoundly public health in nature, that people go to court to be punished. They go to prison to become better neighbors. This is an extraordinary motto for a prison system. It means that every policy, every procedure, every interaction in the prison system is evaluated with a laser focus on how well it helps people heal, how well it helps people change their lives for the better. I want to be very clear that Norway's prisons still take away freedom. As a society, we have to decide when and if that's ever appropriate. Norway cannot help us make that decision. But I do think what Norway can do is their core correctional principles can provide a map for how we can reduce harm immediately in U.S. prisons. I'm going to give you an example of some of those correctional principles, and I'll tell you a little bit about what we've done with those. So one principle is dynamic security. This is the concept that staff and residents should spend all of their time interacting in positive ways together, over leisure activities, literally even breaking bread. This idea that investing in human relationships creates healthier people, it creates safer institutions, it disrupts problems before they happen, and it helps people heal and engage in the world around them. A second core principle is progression. This is this concept that the more closed a system is, the harder it is to return to freedom. And so people get opportunity after opportunity to progress incrementally towards more responsibility and more freedom through hard work in the prison system. And what I really like about this core principle is that the system and the officers expect that people will have a hard time achieving this goal and will kind of relapse or have problems and go back to the beginning and try again. And the motto is, we don't give up on anyone. Another core principle that's sort of gotten a lot of headlines in the press is normalization. These are pictures from a maximum security prison in Norway. The idea is that punishment is the deprivation of liberty only, that prison should resemble life outside as much as possible to ease people's return back into community and to minimize their institutionalization. And another piece of normalization is that no one should be confined in a higher level of security than is needed for their immediate safety or the safety of others. And this is enshrined in law, and it really has to be documented very clearly when they bring people to a higher level of security. As you have seen, this is where many US facilities are starting, where nothing is normal, where people are at times literally held in cages, where relationships are discouraged, poor health is common, and where I would argue people learn how to become better prisoners rather than becoming better neighbors. So we launched Amend in 2015. This is really a nod to the Eighth Amendment to the US Constitution, and also in recognition that we all as citizens need to make amends for mass incarceration and prison conditions. We draw on public health, on medical ethics, occupational health, international human rights, correctional practices from Norway and really beyond, to inspire, educate, and empower US officers and policymakers to immediately address dehumanizing conditions in their prisons that lead to poor health among both residents and staff. We operate 7 different culture change programs on different kind of areas of harm. And I'm just going to focus today on one, and that is the resource team. And this is the Norwegian approach to dramatically reducing the use of solitary confinement. So in 2016, the story begins. The North Dakota Department of Corrections participated in one of our international immersion programs. It's actually Don Spector in the front here from the Prison Law Office who funded our first 2 years of our program. Their goal was to reduce their use of isolation. This is a graph of their use of isolation. So the green and the red are the 2 different prisons that were using isolation. This is like a 6-year time period. The blue is the combined numbers of those 2 prisons together. They went with us to Norway in the first quarter of 2016, and this is what happened, a 74% reduction in the use of solitary confinement, and most importantly, with no increase in institutional or unit level violence that has persisted over time. And so we were thrilled. We tried to replicate the success in bigger states. North Dakota is a very small prison system. And we learned very quickly that larger states require more intensive training and support, especially on the correctional officer level, that it's not enough just to change the policy, open the door, but you actually have to train the staff in a much more deliberative fashion. And as a physician, I also really wanted to focus on the people who were deemed impossible to bring out of solitary, the people who everyone said justified the use of isolation. And that's where we started focusing on the resource team. This is what I would call an intensive harm reduction program that meets the needs of highest risk, highest need people. It is focused on increased attention from trained staff. It's interdisciplinary, so custody, healthcare, chaplaincy sometimes. We use peer mentors in the US, people who have been formerly in isolation in that prison and are now out in general population and being mentors in the program. And the hallmark is meaningful officer-led activities. And what I mean by meaningful is they have to be meaningful to the person who is incarcerated, not to the prison or to the officer. And the goal is to reduce isolation, build coping, communication, and behavior skills, frustration tolerance, things like that. And to do that, staff receive enhanced training in mental illness and behavior change and the harms of isolation, in what their occupational stress comes from, basically from dehumanizing other people. They learn about relationship building, communication, de-escalation, and things like that. So this is what our classroom looks like. We start in a classroom with some of those just training topics. They learn things like an approach to risk assessment, in the moment risk assessment, and how to adapt to that risk assessment over time in short order. They learn about the window of tolerance. This is really like the optimal time that somebody who is very stressed or in a stress situation can be engaged with in a constructive manner, and how to identify when they're in that window of tolerance. We teach officers how to approach a door to bring somebody out in a non-authoritative, non-threatening manner. We show them, or the Norwegian officers show them, how to escort somebody out of shackles so that they are not dehumanized with shackles, even if they have very high levels of behavioral violence. So ways to walk with people that are more humanizing than shackles. We focus a lot on the pre-meeting of this meaningful activity. What is the activity the person wants to engage in? How are we going to make it happen? How are we going to do risk assessment? How are we going to communicate with each other and make sure things are going right? And then there is a constant and hours of focus, especially in the first two activities, on what that activity will look like, where everybody will stand, how they are going to be kind of passively present, positioning, de-escalation tactics, and what happens if something goes wrong. We launched our first resource team in Oregon State Pen, and it was really a feasibility study, like, would the officers do this? And we found, yes, they increased time out of cell significantly. They transitioned people to a lower level of security housing in just a couple months, and they decreased their use of force actually quite precipitously. But more importantly, the impact it had on people. The resource team changed the experiences of people in punitive solitary confinement. This is one of many letters that we got, sort of impromptu letters. This man says, I've been housed in ADSEG, which is solitary confinement, for 11 years. I was pulled out one day and brought into a conference room where 10 of these staff members in the resource team told me they had a vested interest in my success. At first, I was in shock, then skeptical when they escorted me unrestrained out onto the compound. The first thing that went through my mind was I was in plain view of a gun tower. I had doubts I might not make it out of this situation alive. But after we returned to the conference room, there was an overwhelming flood of emotional feeling that gradually turned to a confidence I haven't felt in years. And he goes on to say that this feeling of gratitude has changed his outlook on life and given him a strong sense of pride and accomplishment. The resource team also changed the experiences of people who self-isolate. One person says, that's what the resource team is. You know how many times I tried to tell them, don't show up at my door, I'm not going. They still showed up. How you doing, man? Come on, let's go play basketball. You got to get out of your cell. I said, why? I'm not even in the mood. At first, it was just the conversations and the good vibes. But after that, it turned all to the loyalty, just basically how they're not going to give up on you, because if you got everybody giving up on you, that's how you end up in prison. The resource team also changed the experience of the staff participating in it. After the amend training, I told my wife, I can't be the same officer, it just doesn't work anymore. We had a big disturbance, and I found myself touching a participant on the shoulder and saying, I'm going to take care of you. I don't know if you understand the significance of that. I went 10 years without touching an inmate in a non-use of force situation. I'm not about to say I'm going to take care of you. Since then, I've seen it in all my interactions. People are saying, thanks for helping me. It's amazing. I'm so much better now. Staff surveys also showed kind of a win-win, that they were having improvements in 6-month health and well-being, decline in symptoms of PTSD, again, among staff, improved job satisfaction, feeling like they're a positive influence on others, saying that they wouldn't accept another job. And prison staff on their own organically spread the resource team to another maximum security prison in the same state and really asked us to come in and try again. So in 2019, we went into that state. They launched a resource team, this time all volunteer officers, no protected time, doing this on their unpaid time off. Over the course of about a year and a half, they transitioned 5 people with a total of 80 years of isolation back into the general population. And I'm just going to give you a case example and this person consented to all of this and actually wants us to use his story to explain what this is doing. In 2021, the team started working with really the highest profile resident, the type of person that prisons point to as justification for continuing this use. As an example, since his admission 20 years ago, he's had 21 staff assaults, serious assaults that have resulted in 19 new convictions. 47 years have been added to his sentence. He's been in isolation for 20 years, basically spent 1 month not in isolation. This is him on his first activity. He's right next to a peer mentor. named Mike, who is, as you can see, is just right up against him. It's giving him a lot of security. The officers have him not in shackles. And his goal, his meaningful activity was he wanted to throw football for the first time in 20 years. And longer range, he wanted to reconnect with his Native American roots. He wanted to be in a drum circle, a sweat lodge ceremony, feather ceremony, things that were a little bit more complicated and were longer range goals. But here he is. And so that day he did get to throw his football. And then he, several weeks later, was in a drum circle. And this picture I love because it shows the pictures of all the things that he's thankful for. These are names of the officers on the resource team, the football, of course, but also eventually a feather, because he did participate in a feather ceremony, and they eventually were able to bring him out to the sweat lodge as well. I think that this photo really encapsulates what culture change, harm reduction culture change means. It means two people looking at each other in the eye, shaking hands, an activity that actually used to be able to get an officer in trouble. Shaking hands and seeing each other for the people that they are, not the uniforms that they wear. The mentor says, I love that this is happening. This prison is a community. People live here. Program helps me feel human. It makes me feel like I'm not even in prison. And Captain Jantz, who is in charge of this unit, talks about his transformation. He says, from tear checks, shakedowns, and toss the key to the next guy, to this is where I get my satisfaction now. And from no way to humanity is our most powerful tool. We now have 4 resource team pilots in 4 prisons across 3 states. And I'll just leave you with this one thought, that engaging staff, it's not the be all end all. It's not the answer to all of incarceration problems in the United States, but focusing on their health as a means of ending the use of solitary confinement and the means of changing what is happening in prisons today is crucial and overlooked. And I'll just leave you with this quote. A captain of an isolation unit says, I would say the 15 years I worked here in solitary confinement, I was pretty hardened. During that time, I saw multiple guys that went from, hey, I'm completely normal, to a mental health 3 situation. Today, I believe in my heart, we created some of that. And under my current time in special housing, I will not allow that to happen again. And that's the power of somebody who works there, not because a judge told them, not because a lawyer told them, not because a community organization or a family member or even a person who's incarcerated is begging them to open the door, but because they have identified something in their humanity and they refuse to participate in the job as it was originally laid out for them. So I just thank my funders and thank you all so much for having me despite having to be here far away. Thanks.